Hello everyone. We'll start with a new topic, malaria. It's a protozoa disease caused by infection with parasites of the genus Plasmodium and transmitted to man by certain species of infected female like anopheline. Okay? This parasite Plasmodium vivax will cause the infection and which is transmitted by the anopheline mosquito. So it contains three distinct stages. Those are cold stage, hot stage, and sweating stage. The clinical features of malaria vary from mild, severe, and complicated according to the species of parasite present, immunological status of the patient, intensity of infection, and presence of concomitant condition, that is malnutrition and other diseases. So these are the factors, whether the disease is mild or severe, which type of parasite is present, how is the immunity power of the person, and what is the intensity of infection, what are the conditions present. Based on this, there will be the malaria can be severe or mild, can be detected. The febrile paroxysms occur with definite intermittent periodicity, repeating every third or fourth day, depending upon the species of the parasite involved. Okay. There will be repeated intermittent periodicity every third or fourth day. That is, fever will be up and down. 2 days it will be there. Again there will be gap. Again there will be fever. That is called febrile paroxysm. Epidemiological determinants. The agent is a vector, female Anopheles mosquito, and the Plasmodium is an agent, Plasmodium vivax. Malaria in man is caused by 4 distinct species of the malaria parasite. Those are Plasmodium vivax, Plasmodium falciparum, Plasmodium malaria, and Plasmodium ovale. So these are the 4 species which cause the malaria in the man. The severity of malaria is related to the species. So what is the life cycle? There are 2 cycles the malaria parasite undergoes. First is human cycle, that is asexual cycle, and mosquito cycle, that is sexual cycle. When the cycle in mosquito, when it is bite the infected person, it will get a microgamete, and then it will become a macrogamete and zygote. And zygote will form into the oocyte, then cyst will burst, then there will be sporozoids. That is in the salivary glands. When it bites the human again, this sporozoid will reach the hepatic cell in the liver and will become hypnozoid, that is hepatic dormancy. Then again it will mature in the liver, that is called mature liver schizon or merozoids. Then it will reach the erythrocyte, becomes trophozoite, and later it will become erythrocytic schizont. Then erythrocyte will rupture and there will be presence of gametocytes. So this is the human and mosquito cycle. Man is the intermediate host and mosquito the definitive host. Asexual cycle. The asexual cycle begins when an infected mosquito bites a person and injects sporozoids. When the sporozoid enters a person, further pathology takes place in defined phases. The defined phases are known as hepatic phase, erythrocytic phase, and gametogeny that we have seen already. Here in the hepatic phase, the sporozoids disappear within 60 minutes from peripheral circulation. Many of them are destroyed by the phagocytes, but a few reach the liver. After 1 to 2 weeks, the sporozoids develop into the hepatic schizont. The hepatic schizont eventually bursts, releasing a shower of merozoids. Sometimes the intrahepatic schizont grow and become pre-erythrocytic schizogony, thus liberating merozoid into the bloodstream. Once the parasite enter the liver, they do not reinvade the liver. This is followed by erythrocytic phase. In the erythrocytic phase, these are quickly destroyed, but a significant number of them attach to a specific receptor sites in the RBC. The merozoid then penetrate the RBC and pass through the stages of trophozoites and schizon. The erythrocyte phase ends with the liberation of merozoites that infects infect fresh blood cells. The cycle is repeated over and over again until it is slowed down by the immune response. The duration of the erythrocytic phase is constant for each species. So for the falciparum, vivax and oval it is 48 hours, and malaria it is 72 hours. In the gametogeny, in all Plasmodium species, some erythrocytic forms do not divide but become male and female gametocyte. There are the sexual forms of the parasite which are infective to mosquito. Those are called gametocytes. And coming to the sexual cycle, or also called as mosquito cycle, the sporogony begins when the gametocytes are ingested by the vector mosquito when feeding on an infected person. When it bites the infected person, the gametocyte will invade into the vector's body. The gametocyte continue further development in the mosquito. The first event to take place inside the stomach of the mosquito is the explanation of the male gametocyte. Okay, they will be busting what we have seen in the cycle in the first slide. The same thing is explained detailedly in here. 48 thread-like filaments called macrogametes are developed. The female gametocyte undergoes a process of maturation and becomes female gamete of macrogamete. The process called chemotaxis. Microgametes are attracted towards the female gamete, and one of which, that is microgamete, cause fertilization of the female gamete. The zygote is formed. The zygote is at first a motionless body, but within 18 to 24 hours it becomes motile. It will move in the vector's body. This is known as ookinete, which penetrates the stomach wall of mosquito and develops into the oocyte on the outer surface of the stomach. Okay, outer side of the stomach there will be formation of oocyst. The oocyst grows rapidly and develops within its numerous sporozoids into the body cavity of the mosquito. Many of the sporozoids migrate to the salivary glands of the mosquito. So afterwards, sporozoid will move to the salivary glands of the mosquito. When again the mosquito becomes infective, when it bites the person, he will get infected. The period of time required for the development of the parasite from the gametocyte to sporozoid stage in the body of the mosquito is about 10 to 20 days, depending upon the favorable conditions. What we have seen already. The conditions include atmospheric temperature and humidity. This period is also known as referred as extrinsic incubation period. What's the reservoir of infection? The human is a reservoir. Human reservoir is a person who harbors the sexual forms, that is gametocyte. A patient can be carrier of several Plasmodium species at the same time. He will be having many species in his body. Children are more likely to be carriers than adults. There are certain conditions to be fulfilled to be in the state of reservoir. Because when the immunity is low, they will be good reservoir. The person must harbor both the sexes of the gametocyte in the blood. The gametocyte must be mature. Gametocyte must be viable. Gametocytes must be present in sufficient density of the infected mosquitoes. There must be at least 12 gametocytes per cubic millimeter of the blood, then only he will be infected. Period of communicability. Malaria is communicable as long as mature, viable gametocytes exist in the circulating blood in sufficient density to infect vector mosquitoes. Gametocytes are the most numerous during the early stages of the infection, when their density may exceed 1000 per cubic millimeter of blood. They also tend to occur in waves in the peripheral blood. The relapses, vivax and ovale malaria tend to relapse more than 3 years after the patient's first attack. Recurrence of falciparum usually disappear within 1 to 2 years, okay, because they will develop the immunity. Malaria has a tendency to cause prolonged low-level asymptomatic parasitemia. Okay, they will be asymptomatic, even though they have the infection, they will be asymptomatic. Okay. Host factor. Malaria affects all ages, and newborn infants are considerable resistant to infection due to high concentration of fetal hemoglobin during the first month of the life. Okay. And they will not get the malaria. Males are more frequently exposed more than females due to their outdoor life. Females are better clothed than males. Individuals with AS hemoglobin, that is single cell trait, have milder illness. Pregnancy increases the risk of malaria in women. Malaria during pregnancy may cause intrauterine death in fetus. It may cause premature labor or abortion. Socio-economic development. Malaria demonstrates a relationship between health and socio-economic development because when the socio-economic condition is lower, then the environmental factors will allow them to grow more mosquito and they will transfer the infection. It's observed that malaria has disappeared from most developed countries due to socio-economic development. Housing, ill-ventilated and ill-lighted provide ideal indoor resting places for the mosquito and so that they will transfer the infection. Population mobility, laborers connected with engineering, irrigation, agriculture and other projects, migrating nomads are more disposed to develop malaria because they will come in face to face with the malaria infected area so that they will get the infection. Malaria is predominantly a rural disease and has direct connection with agriculture and related occupation because they are staying outdoor always. Human habits such as sleeping out of doors, nomadism, absence of personal protection measures increase the risk of contracting malaria. And immunity, epidemic malaria is influenced by the immune system of the population. Immunity is acquired only after the repeated exposure over several years.